everyone. This is Krishnaveni, Assistant Professor of Sri Venkateshara College of Physiotherapy, Tamil Nadu, India. Before starting into my presentation, I would like to thank Inti International University for giving the wonderful opportunity to present my work. I am going to present a topic on efficacy of progressive resisted exercise training on urinary CTX2 level and functional capacity in knee osteoarthritis. Coming into the introduction, osteoarthritis is a chronic degenerative joint condition which is characterized by pain, swelling and stiffness that affects the cartilage that helps person's ability to move freely. It can also impact the surrounding tissues and leads to changes in the bone and supporting structures of the joint. Osteoarthritis is the most prevalent widespread musculoskeletal disease in the world. It is most severe joint disorder with the prevalence of 22 to 30% in India. Knee osteoarthritis is much more prevalent in India than the Western countries. It is most common cause for the joint dysfunction. The extent of osteoarthritis within each joint is usually assessed by radiographic characteristics and expressed as the Kelligren score. Early diagnosis of knee osteoarthritis remains a diagnostic challenge due to the limited signs and symptoms presented during the early phases of the disease. Radiographic evidence of osteoarthritis is potentially late sign because the irreversible joint changes may already occur. Magnetic resonance imaging and biomarkers are potential diagnostic tools used to overcome this problem. However, the use of magnetic resonance imaging is limited by cost, availability, and the absence of validated international scoring system. The C-terminal cross-linked talopeptide of type 2 collagen, which is shortly called as CTX2, it is a byproduct of type 2 collagen breakdown that is localized almost exclusively in the cartilage. Coming into the niche for the study, the previously published study showed that the urinary CTX2 level in patients with knee osteoarthritis were significantly higher than in healthy people. Therefore, the urinary CTX2 level can be used to distinguish patients with knee osteoarthritis from healthy subjects. The study explained that the progressive resistance strength training of lower limb rehabilitation protocol is effective in terms of reducing pain, improving mobility and activity of daily living among knee osteoarthritis patients who are overweight or obese. Therefore, the purpose of the study is to focus on progressive resisted exercise training from the low intensity to high intensity by gradually increasing the intensity, frequency and duration in order to reduce urinary CTX2 level and to improve functional capacity in knee osteoarthritis. Coming into the aim and objective of this study, the aim is to find out the efficacy of progressive resisted exercise training on urinary CTX2 level and functional capacity in knee osteoarthritis. We have two objectives of this study. First one is to evaluate the efficacy of progressive resisted exercise training on urinary CTX2 level in knee osteoarthritis patient. And next one is to evaluate the efficacy of progressive resisted exercise training on functional capacity in knee osteoarthritis. Coming into the hypothesis, null hypothesis states there is no significant changes with the efficacy of progressive resisted exercise training on urinary CTX2 level and functional capacity in knee osteoarthritis. Alternative hypothesis states there is a significant changes with the efficacy of progressive resisted exercise training on urinary CTX2 level and functional capacity in knee osteoarthritis. Coming into the methodology, I have chosen pre-experimental study design with a single group of pre-test and post-test analysis. The study population were knee osteoarthritis patient with the elevated CTX2 level. The study was done in outpatient department of Sri Venkateshara College of Physiotherapy and KMC Hospital, Tamil Nadu, India. I have chosen random sampling technique for taking the patients. I have taken 20 patients with 12 female and 8 male. The duration of the study was 6 months with the 12 weeks of treatment duration. Coming into the selection criteria, I have chosen the patient according to the following inclusive criteria. The patients who are clinically and radiologically diagnosed with knee osteoarthritis with this Kelligren score of 1 to 3. Patient age between 50 to 60 years and the elevated CTX2 level more than 300 nanogram per millimole of creatine and willing to participate and provide the informed consent. and the patient with the following criteria were excluded in the study. Those were inflammatory arthritis like RA or gout, and recent steroid injection within the 3 months of duration, and severe cardiovascular or neurological disorders, and with cognitive impairments. So these all are my exclusive criteria. The patients with these problems were excluded in my study. Coming into the variables of the study, the independent variable would be progressive resisted exercise training of lower limb rehabilitation protocol, and dependent variables would be urinary CTX2 level and functional capacity. The focused outcome were to reduce urinary CTX2 level and to improve functional capacity. The outcome measures were used as urinary CTX2 level and WMAX score. The statistical tool which is used to analyze pre-test and post-test values of single group study was paired or dependent t-test. Coming into the exercise intervention, patient were received progressive resisted exercise training of lower limb rehabilitation protocol for 3 times a week for 12 weeks from low intensity to high intensity exercises by gradually increasing the intensity, frequency and duration. So these trainings included the strengthening exercise for the lower limb in non-weight bearing, sitting or lying positions. Each training session started with 10 minutes of warm-up, 45 to 60 minutes of progressive resisted exercise training of lower limb rehabilitation protocol, and ends with 10 minutes of cool down. Coming into the data analysis, so these all are my demographic analysis. So within group analysis of CTX2 level and WMAX score as follows in the table. Coming into the results and discussion, the statistical analysis shows the significant changes when comparing the pre-test and post-test values of urinary CTX2 level and WMAX score at the level of significance less than 0.05 with the t-value of 2.195 and 2.568. These were higher than the tabulated t-value of 2.0888, shows statistically significant improvement within the group. The findings of present study revealed that after 12 weeks of training program, there is a significant changes in the values of urinary CTX2 level and WMAX score after the application of progressive resisted exercise training in knee osteoarthritis patient. So the alternative hypothesis were accepted and null hypothesis is rejected. Because there is no cure for this disease, current medical practices focuses on such interventions that reduces progression of the disease as well as the negative impact on the health related quality of life. Exercise is often indicated as one of the main components in rehabilitation process. Core recommended treatments for knee osteoarthritis in clinical guidance or lower limb muscle strengthening. A systemic review and meta-regression analysis of randomized control trial was reported that optimal exercise program should focus on improving lower extremity performance or quadriceps muscle strength among knee osteoarthritis patients. Therefore, the training session of progressive resistant strength training of lower limb rehabilitation protocol were used in the current study. A published experimental study recommended the easier exercises in order to perform and continue with low intensity exercises for knee osteoarthritis patients. Another repeated study points to the fact that greater the intensity of exercises, greater would be the output effects on the knee osteoarthritis. In this current study, the intensity of training session of lower limb rehabilitation protocol were gradually progressed from low intensity to high intensity to study the progressive resultant changes due to the successive intensity of exercise. In addition to our knowledge, there are no such studies were proposed with the analysis of the efficacy of progressive resisted exercise training on urinary CTX2 level and functional capacity in knee osteoarthritis. Coming into the conclusion, the study finally concluded that there is a high significant changes after the application of progressive resisted exercise training on urinary CTX2 level and functional capacity in knee osteoarthritis patient, showing the reduction in urinary CTX2 level and improvement in functional capacity in knee osteoarthritis. Coming into the limitation and future scope, we have assessed only 20 patients. The future studies can be done with a greater number of patients, and we observed only the subject for 12 weeks. The future studies can be done with the extended duration because the future studies needed to examine the long-term outcomes and urinary CTX2 level can be measured for long-term period. And this is a single group study. Further studies can be done with the control group or other exercise interventions. These all are my references. Thank you.